Welcome back. It is 7:40. The first cases of Ebola in the U.S. attracted world attention, not really the kind of attention a city or a major urban hospital would want. Merrie Spaeth counsels companies and executives, even a former president, and joins us this morning. Thank you so much for being here.
Good morning.
I know those that don't know the facts and live in other parts of the country hear Dallas right now. There are some people that hear Dallas and think, oh, Ebola, you can get Ebola if you go to Dallas, which we know is not the case. But this is not something the city really wants to be known for. How does the city get rid of this black eye?
Well, I think you compete with good news. You compete with it in the healthcare industry, which I think that the city is already doing with the state, with Governor Perry's announcement that one of Methodist's hospitals is going to be converted to a leading edge facility, and it's going to be a consortium of organizations from Dallas. Dallas is a major healthcare leader, where I mean we are the good guys. So on the one hand, they're competing in the field, trying to crowd out the bad with good news. And then I think you just have to be in it for the long haul. Both Dallas and the hospital need to remember that life is long, and this is just sort of the new variation of the day.
This is just a bump in the road, basically.
Absolutely.
I know I've talked with healthcare workers that are at Presby, and they have seen patients, canceling appointments left and right. I know some of the OBGYNs. Presby was a huge place to have babies, and I know that some mothers have tried to have their babies at other hospitals. What do you say to them? There's no question that this has hurt the hospital. I mean, they've admitted to that. They've said their numbers are down. How long do you think it'll take before this turns around, and what does the hospital need to do?
Well, I think one thing you don't do is try and put it in perspective by saying, more people are killed by lightning than Ebola. Nobody cares about that. That's just arguing on the wrong turf. If there are no more cases, which I am cautiously optimistic that that will be the situation going forward, I think this will be like other things like West Nile virus, if you remember, and I remember H1N1, and that people will quickly return to their senses as things cool down. I think that the key thing, though, for any hospital, including Presbyterian, is that they've got to enlist their own employees. The nurses at this point, as we're hearing from them, are not happy, mainly because there's been such a tremendous lack of certainty. But I think if they enlist their own employees and remind people it's a great institution with great people and they've got a great track record.
Yeah, Presby's had a good reputation for so long. It just might take some time to remind people that that's the case. It's clear there were major mistakes that were made. Who takes the fault here? I feel like somebody always takes the fault in something like this. Some people say maybe a local point guy, Judge Clay Jenkins. Some say the hospital. Some say the healthcare workers. Others say CDC. What do you say?
I would come down that most of the blame should be ascribed to the Centers for Disease Control for several reasons. First of all, in the beginning, they projected, no big deal, we're ready, any hospital can handle that. So it's not surprising that hospitals picked up that line and believed it. Then their director had one of the worst press conferences I've ever seen Sunday a week ago, where he said breach of protocol about 13 times and the word contaminant. So those became the headline, breach of protocol, breach of protocol, breach of protocol. And then they changed their story. You cannot make major changes in communication on a whim, because you're not just speaking to one person, even though you and I are talking, you're speaking to the world. And they kept issuing changes, so it was very understandable that that would generate confusion.
Yeah, it does seem like the public's trust in the government and the healthcare system has definitely, been bruised some, because I did feel like we heard one thing, and then the next day we came in here to our Good Day studios and they were saying something else. So, that was definitely something that was difficult to deal with, and I think the public saw that.
I think so. Of course, that's against the whole backdrop of distrust in government in general for other reasons that we probably shouldn't get into here. But I think that you simply cannot change your story that quickly. And the director also spoke as if he was speaking to healthcare professionals. He talked about the index patient. Not an index patient, she's a person.
Right, exactly.
You can't use that kind of jargon.
Yeah. So maybe some careful choice of words would have been better than in that case, definitely.
That's right. Even in our lingo, where you have good words and bad words, safety being a good word and Ebola being, alas, a very bad word.
Yeah. Thank you so much for joining us. Appreciate it.